Welcome to Seriously, the podcast that dives into the baffling.
We can't send them to a prison where there's animals, where there's livestock.
The ridiculous.
Like omelets better than sex.
And downright unbelievable political climate in red states like Louisiana.
So we can't go there. There are no vegan jails.
Seriously. Seriously.
Welcome to Seriously. We are excited today to have a special guest host, actually, because Ellie is out. She's working on a trial somewhere in Louisiana. And so I invited my good friend, Melissa Flournoy, to join me on the podcast today as our guest host. I've known Melissa for too many years, I guess, at this point. And she is just one of the funniest and most fiercest advocates that we have at the state capitol. And so, Melissa, welcome to the podcast. Why don't you tell the listeners a little bit about yourself?
Well, thanks, Michelle. It's great to be with you today. And, I'm now a woman of a certain age. I'm 63 years old. I got elected to the Louisiana legislature when I was 30. I've been involved in Louisiana politics really since the late 80s when I ran a nonprofit community resource center up in Shreveport that was really focused on trying to deliver services to some of the most disadvantaged young people and their families in our state in what was then called the Ledbetter Heights neighborhood or the Bottoms in Shreveport. So I've been, I guess, a warrior for women and children for my entire career. And I just can't take it anymore. I am so sick of having the same conversations for 35 years. One of the newest groups that I'm involved with is a group called 10,000 Women Louisiana. Some people have started calling us the menopause militia because we're women who have nothing to fear. And frankly, we're trying to create a multiracial, multi-generational network of women who are willing to be outspoken, who are willing to show up at the Capitol, who are willing to protest in the streets, that are willing to do whatever needs to be done to tell the truth about what's broken in Louisiana and frankly now what's broken in the country. So, on any given day, I vacillate from being in a homicidal rage and mad as hell to just sort of kind of can't figure out the absurdity of the universe. So I'm grateful to be here today with you because Louisiana is ground zero. We're ground zero for Donald Trump. We're ground zero with Jeff Landry. We're ground zero for poverty. We make policy decisions in Louisiana because we want to keep people poor. And we have never gotten over the plantation economy and the plantation mindset. And so in the 21st century, it's time for us to just call it like we see it and hold people accountable. Because trying to play by the rules has not gotten us the progress that we need. And frankly, I'm just tired of having the same conversations for over 4 decades now. So I'm grateful to be with you. I'm happy to be a truth teller. And I just want to lift up the people that are in the fight in Louisiana. And so I'm super excited to be on the show today with you and Frankie so that we can talk about what's really going on in Louisiana and how we can be more effective in just raising hell and trying to get shit done. That's pretty much what we've got to do now.
Absolutely.
So thanks for letting me be on the show.
Thanks, Melissa. Well, we are going to have a different conversation today because, as you mentioned, we have joining us as our guest someone who has really been leading the fight around improving maternal health outcomes, especially for Black women in the state who are dying from pregnancy complications at a rate 2 to 4 times higher than white women in the state. And so we have Frankie Robertson with us today, and Frankie and and Melissa have been at the Capitol year after year after year fighting this fight. And I'm really excited to talk to you about how we save pregnant women's lives in abortion ban America here in Louisiana. So Frankie, welcome to the podcast. And please tell the listeners a little bit about who you are and the work that you're doing to save women's lives.
Hey, Michelle. Hey, Dr. Flournoy. Thank you so much for allowing me to be here today or inviting me to be here today. So, my work in maternal and child health really spans more than nearly 2 decades. I started with the National Health Organization as a state director and then worked in public policy and grassroots advocacy for multiple states, including the territory of Puerto Rico. And in this role, I mean, I've had an opportunity to work the majority of the southeastern states in our country and look at policy opportunities, initiate policy action, working with grassroots organizations, multiple maternal health and social justice organizations, policymakers, and lobbyists. And just to having the opportunity to notice certain trends, certain disparities, a plethora or a myriad of disparities in the South that just really consume us. I am also a mission mom. I founded the Amandla Group. It's a social justice consulting firm where I raise or elevate the voices of moms and families and birthing people who have a story to tell. And I work with them and we engage in advocacy. I work with various organizations that are maternal health organizations. I represent them as their lobbyists. I represent them in leading their advocacy efforts and developing their strategy. And we've had a host of successes over many years, particularly these last 5 years, with really moving policy. And we can talk later about the various topics related to maternal health, but through my work in this field and also being a mission mom, I know that the work, as people try to compartmentalize it, is not able to be compartmentalized. When we talk about reproductive justice, when we talk about the health of moms and babies, infants and infant mortality and maternal mortality, it cannot be compartmentalized the way that our policymakers, some of our policymakers, that is, are trying to compartmentalize it because it's causing people to lose their lives or come very close to it. I'm a mom of two. I have a 9-year-old that was born healthy, and I have a 7-year-old who was born preterm 3 months early. And I always known I wanted to be a mom. There's nothing that I've always known. And I am happy about that. And that is my choice. I have been on two ends of the spectrum to have a healthy baby boy, and I've had pregnancy complications despite all of the insurance I have and my maternal health knowledge. So I am happy to use my lived experience and amplify the lived experiences of women, Black women, all women, birthing people in our state to really move the needle against the grain, and policymakers who don't seem to truly want to move the needle and really save lives beyond certain speaking points sometimes that political parties stick to on the backs of women and children.
Thank you so much, Frankie. I do want to kind of get into some of the policies that you have fought for and actually passed over the past couple of years and what that experience has been like, because one of the things that I find so fascinating about the way you work, and one of the things that has made you such an incredible partner for those in the fight for abortion access, is that you have really been strategic about building relationships across the aisle. You work with people that are very, very, very anti abortion, but they actually really do legitimately care about pregnant women, and they want them to have healthy births. They want them to carry those babies to term and have healthy births. And then you also work with a lot of progressive legislators. Well, not that we have that many progressive legislators in Louisiana, but the handful that we do, you've also worked with them. So um, I'd be interested to hear a little bit more about your experience working across the aisle to get some of the policies passed that you've been able to get done.
Yeah, I think first, as much as I can slash we can, because it's not solely me, I have the opportunity to work with several organizations that I represent as a lobbyist that I'm engaged with on a community level. who have reached out to me to engage and lead their policy initiatives. So we are working together in a shared collaborative effort. So I don't want to take credit for that. And also just our policymakers who've been phenomenal to work with, who have been open to being educated about the issues, open to embracing and leading them. Certainly want to keep them at the forefront of this, and thank them for their leadership and their relentless leadership in this. But for me, the way that I like to approach this is that we take a look at the things that we collectively care about. Unfortunately, in our state, there's the common denominator of things that we care about. And then there are different outliers, right? That disrupt that progress, right? I care about moms and babies, maybe the sentiments expressed by legislator A, but I am not going to go against my party on what they believe about issue A. That's a problem.
Like funding.
Like funding, like access to care, like being open-minded about understanding that there are people in our state who've reported bleeding out because of the abortion bans that have been impacted, and understanding that you're not separating the two. One of the things that I see that is really disturbing, and I'll circle back in a second, that I've noticed is that there there's always a lot of negotiating, a lot of open to just meet in the middle with the people that I work with. But the people who say that they care about the same things with the common denominator are not willing to bend at all. And that type of closed-minded policy is killing people, right?
Well, Frankie, I want to jump in on that because part of this is where the medical model and hospitals and OBGYNs fit in. And then you've done a lot of work with birthmark doulas and midwives and community care workers and sort of building up sort of trusting, helpful options to support pregnant women to deliver healthy babies. And there's a I don't know, a weird dynamic of protecting the OBGYN medical profession and trying to build out sort of uh, thoughtful community caring services to support pregnant women. And so you've done a lot of work on getting doula services recognized by the state, talking about birthing centers versus hospitals. So, can you talk specifically about sort of the political dynamic of trying to expand access to healthcare, particularly for low income women or African American women who need those doula services, and how hard it is to try and sort of change the dynamic in a very healthcare centered hospital based model?
I think for one, that's a loaded question, but I'll just make it simple and just say at the root of this is a system that is broken, that totally needs to be overhauled. But it's kind of, and I'm not the expert on like this system. I just see like the user end of it and also like the policy end that is going nowhere fast. But at the root of this cannot be capitalism, but it is. At the root of this cannot be making the doctor's accommodations or their business model a priority over the care of their patients. I've seen too many times in pushing for legislation that benefits the patients, that policies that we're pushing that ultimately benefit the medical providers, clientele, it's one not initiated by whom, whatever the system is that is lobbying collectively for the medical community. One, not bringing these policies forward, which you would think that it could come from that body or body of representatives, or two, being directly engaged in dismantling it if there's a question about the business interests and protections of the medical community. And that's a problem, right? I know that just this past legislative session, I worked on behalf of my clients and organizations like LPHI. They were engaged in this fully. And we literally actually we wrote the language for Senate Bill 190 that was carried by Senator Boudreaux, and approached him and shared the problem, and he was very eager to support it. So that bill, which was designed to increase Medicaid reimbursement rates, absolutely impacts and supports a critical need that the doctors are facing with being able to sustain healthy business practices, which in turn impacts the people that we care about who can't get care because there's not enough doctors providing Medicaid coverage, and there's maternity desert. So there's a direct ripple down effect to the people that we care about that we're representing. So just as we were able to see that as the birth work community and a more social justice user in community, something benefiting the doctors, we need that same momentum coming from the medical community to say, yeah, we think that we can use our power and our leverage to say, hey, these are things that can make life better or preserve life for our patients and people we care about. But we're not necessarily seeing that same energy when it comes to things that might be slightly controversial or questionable about whether or not it creates a liability for the medical community to just provide a service to their patients.
Well, Frankie, one of the things that I want to jump in on there is let's look at the data in Louisiana, okay? Because at one point there was some study, I don't even remember the year on it, that talked about how many cesarean sections we had, and that we had like more C-sections than comparable states. And it seemed like we were doing inducing babies or doing C-sections to accommodate the schedules of OBGYNs. And so, another issue is around, OBGYNs not wanting to partner with doulas or midwives or sort of a continuum of care or sort of a new model to care for pregnant women. You know what I mean? And so how do we sort of change the 19th century paradigm to deal with the 21st century world and have a more, I don't know, patient centered approach where it's not just driven by, oh, we can't see you till you're 12 weeks pregnant, or because we're worried you might have a miscarriage and we're worried about criminalizing, obstetrical care. I mean, all of our priorities just seem whack right now. I can't think of a better word around, how do we get people to then come back and say, what's in the best interest of pregnant women? And how do we fund doula services? How do we see women earlier? How do we deal with the fear in the medical community that, oh my gosh, if somebody has a miscarriage, it's going to affect my data as an OBGYN? Or, oh my God, I might actually have to take care of a patient having a miscarriage. I mean, we are in sort of a dystopian nightmare where doctors are afraid of their patients.
Doctors
What's
aren't afraid of their patients. It seems that perhaps the medical community members that aren't speaking up, or maybe, in your words, afraid of the establishment itself, right? Repercussions from policymakers or people who are part of, maintaining the status quo. I'm certainly not a physician, so I can't speak for them, but they're not afraid of their patients. What I would like to see is more of a unified response from the medical community to push back. I mean, there are people in the legislature that do not have any sort of medical knowledge, medical anything, that are making decisions based upon party speaking points and campaign promises, or things that they may not even truly believe in, that are antiquated, that are proven hypocritical in many instances. And it's really time out for that. When is someone going to stand up and say, that this is truly hurting people, this is hurting constituents, this is hurting my patients, and not leave others to put themselves out there to come and speak out against this. Like, we have to be unafraid to do what's right, and that's where I'm seeing some of the gaps as it relates to the policy piece. Look, this is not comfortable for anybody. Anytime anybody speaks out and speaks the truth and goes against the status quo, anybody with the understanding of just the climate that we're in knows that you're taking an element of the risk. But if you're looking of element of a risk, but if you're looking at knowing that what you were doing is right, and this is beyond you, beyond your generation, saving lives on a systemic level, doing what's right and fair, then you're not calculating that individual risk to you. You are standing on your truth, you're standing on your principles, and you realize that this is bigger than you. So no, people are not afraid of their patients. Perhaps there's times where people are afraid of political fallout or something like that, and of course their own livelihood. But again, if this is about the patients, if this is about life, if this is about moms and babies, we have to approach this differently and do better.
Yeah, I would agree. And it's not, I guess it's not so much that they're afraid of their patients, they're afraid that providing the standard of care that they were trained to provide to their patients now could put them in jail for 10 to 15 years in some circumstances. And that reasonably is making people nervous, and it's leading to these delays in care in a state that already had a maternal mortality crisis, already had women dying of pregnancy related complications that were in most circumstances, like over 75, I think percent, 80% of them were preventable. These are things that we can prevent. There are interventions that can happen before it gets to that point. But one of the things, as Melissa was saying, that I think is so remarkable about what you're doing is you're going back even earlier, really pushing on creating a sustainable community care kind of network and having the state support that. So early on, people can have the support of doulas, people can have access to a midwife. And I think that that is really critical, especially because let's face it, I mean, COVID really destroyed people's trust in the healthcare system generally, but there has been a problem with trust with the healthcare system among communities of color for a long time. And we talked about this a little bit before we started recording. So I'm gonna kick it over to you, Melissa, because I know you had a very specific question that you wanted to ask about how how people of color are treated in the healthcare system.
Well, I just worry that we have such systemic racism in our state, and we see it play out in terms of access to care, and we see it play out in the data. Okay. And so, one of the things that I'm so personally offended by is when Dr. Bill Cassidy, who's now our United States Senator, in a very offhanded way said, "Oh, well, our numbers aren't so bad if you like take out the black people." Okay, that's sort of a paraphrase, but that's literally what he said.
About a third of our population is African American. African Americans have a higher incidence of maternal mortality. So if you correct our population for race, we're not as much of an outlier as it would otherwise appear. Now, I say that not to minimize the issue, but to focus the issue as to where it would be.
Um, and when we're talking about maternal health and we're talking about health outcomes, Louisiana, it's more dangerous to be a pregnant black woman in Louisiana than just about anywhere else in the world. And so I'm just struck by the pervasive racism, the pervasive, I don't know what it is, hypocrisy of folks that can talk about, oh, babies are so precious, and oh, we have to protect the babies, and oh, the babies. And then we don't really care about the babies or the mothers of the babies. And then once the babies are born, we definitely don't care about them because we don't want to make sure that they've got food, clothing, WIC, diapers, health care. So if we really cared about the babies, why aren't we investing in a continuum of care that includes maternal health, but also WIC, the home visitation, nurse family partnership, um, parental support, uh, all those extra expenses that go along with having babies. And also, why don't we have paid family leave for you young or new mothers to help them, get through this transition? And so, my frustration, frankly, is we want pregnant adolescents to have a baby on Friday and go back to work in the drive-through at Taco Bell on Monday. And it is just appalling. And I don't know where the outrage is on behalf of all these people who love babies. And so, I'm just beyond worked up on just the hypocrisy and the mean spiritedness in our legislature that is just, well, number one, it's unchristian for all the Christian pro life people. And number two, it is so destructive that so many of our young mothers, particularly, don't get off to a good start, able to support and nurture and feed and clothe their children because of the economic stress. And so, that's sort of my rant of the moment. Michelle, I'm not sure if that's the rant you wanted, but, that's the one I can dial up on demand because it makes me crazy. Because for the most pro life state in the country, we are the least pro baby.
Yeah, Frankie, do you think we're the most pro-life state in the country?
Not by my definition of pro-life. I mean, by this definition of pro-life that people have created to fit their own best interest and their own feel-good opportunity to seem less like a bad actor or a bad player or less faith-driven person, by that definition. But no, we're not pro-life. And I can speak to that on so many levels. And no, it's hypocrisy, at best. But Melissa just mentioned just so many things. There's such a load of questions. So I'll just start with Dr. Cassidy. We know that a few years back, there was a lot of media on his statement about correcting for removing the statistical data on Black women, and, all may look well, and I'm paraphrasing as well. But the interesting thing is that fast forward maybe 2 years later, maybe even three at this point, here we are with anti-Blackness being on full display and not cloaked the way that it had been. You've got dismantling DEI efforts that hurts everyone. We know it mostly hurts white women. It preserves the patriarchy. So I'm going someplace with this, so just bear with me. Now we see the layoffs and the total just destruction of certain departments and HHS and NIH. And from what I understand, there was or still is a pause on like PRAM's data, right? So it's just interesting that a few years ago, this comment was made, and fast forward, here we are. There's a whole list of things that the federal government, and now soon someone's trying to do it in the state too with state agencies. There's a bill filed for that to remove any sort of equity-based anything based upon race, ethnicity, gender, disability. So again, like you look now and it's like, oh, well, he said that and he really meant it, because now there's efforts to not even have access to that data. And there's efforts to make sure people don't say anything about race disparities or Black, right? So here we are, and it's all in our faces. Now, Melissa brought up a lot of other points, and I'll just try to centralize it like this. When your goal is to preserve the patriarchy, yes, you can say that I love babies and I love moms until they are African American, until they are Hispanic, until they are undocumented immigrants, until they need protections in school under the Department of Education. You can say all of these things, but do you really mean it? And I think the actions speak louder than words. That answer is no. So, how can one even remotely be the true definition of pro life when, in an effort to maintain the status quo, excuse me, and attack blackness, that you're willing to allow everyone in between to be a part of the collateral damage in the name of you're on your own after you give birth, because there is something that you are not doing right for the reason that you can't eat, or that you can't go to work, or that you are working in a fast food job and making low wages. The fact that you have health challenges, it's always a blaming of that person and not the systems that created the disparity, that even after all of the education that's there, right, people are disregarding it, or they are not willing to educate themselves on how they are continuing to perpetuate policy violence in the 2025 year, no different than 1920, 1930, 40, 50, 60, 70, 80. There has to be some willingness to do better and to be individual thinkers to really earn that pro-life label and badge that is a true one. And unfortunately, we're not seeing that across the masses, and that is very problematic.
Yeah, I wanted to pick up on that because when it comes to some of the things that you've been pushing, it seems like a big barrier is that it would actually cost the state a little bit of money to improve health outcomes, to do the things that we know
Not
need
do
to be
it.
done.
Right. It's costing the state to not do it.
It's costing the state to not do it. That's right. And we also know that the Louisiana Right to Life has like an extraordinary amount of power. And so, what we like to do on this podcast is point out the fucking hypocrisy that's going on with the pro life people in general. But the fact that they have spent zero of the massive amounts of political capital that they have up in Baton Rouge to help you get some of your policy priorities over the finish line is extraordinary to me. I
Wait,
mean, you do
sorry.
not see them showing up.
They have done what?
Zero,
Okay, great. Okay, thanks. I just make
zero.
correct.
Yeah. I mean, it's extraordinary. It's
What is the
extraordinary.
definition of pro-life then? I think it goes back to your question. And like I mentioned earlier on in this podcast, I mean, it will just speak the truth. I mean, for those of us who are pushing these policies, and I hate to call them progressive, they're just human rights policies, and they're evidence-based. They're not things that we just made up one night and said, hey, let's try this. They're evidence-based policies, and they have minimal, in many instances, minimal fiscal investments that are necessary, especially when you look at the exponential cost of doing nothing. We are constantly extending an olive branch, reaching out, trying to build a network and educate people on what needs to be done. And there was an attempt last legislative session with representative from Right to Life, and I had a meeting and said, hey, here's the things that we're working on, and where are you on this? Will you support this? And there was no support after that. So, like, what is the definition of pro-life that we're all working with? I think respectfully, we have two operating definitions. And as far as the legislature is concerned, there were a lot of folks who were in support, but there were key people who were not in support, that there wasn't even movement on one bill in particular. And there were others that were, so thank you. But one bill in particular that was less than $400,000 that would have provided preconception, labor, and postpartum life-saving support that wasn't passed. But there were millions of dollars spent on other things. And most recently, very disturbing, that the community has really pushed back on is that our executive branch of government is celebrating a $39 million price tag on building a juvenile facility in central Louisiana. In that same finance committee, we literally sat for hours to plead the case on a very small maternal health package to invest, and there were no dollars to invest. How can we make that make sense? And how is that pro-life? We're jailing children, but we're not helping moms have healthy babies and giving babies the opportunity to come into this world safely and healthy.
Okay, well, Frankie, I just have to say it. Listen, if we wanted to invest in healthy babies and young children and quality child care and early education, we could divert young people getting off the rails in middle school and high school because they'd have more compassionate, caring relationships and being able to bond with. I mean, all the social emotional stuff and all the research says invest on the front end. Okay. If you want to.
Research says pay their parents a living wage, and that for every dollar the minimum wage goes up, infant mortality goes down by a percentage. And that's been presented in labor and industrial relations for many years, and that's fallen on deaf ears. So the research is there. Why not pay the parents more so they can support themselves and have access to top quality insurance? Why not that? We know the answer.
100%.
Well, what can we do in this upcoming legislative session? What can advocates and citizens do to help support you, to help support better policy, more funding, a more sane approach in Louisiana to support healthy babies and healthy moms and getting kids off to a good start? And how can we mobilize to support you?
Well, one, we can show up. There is no such thing as too little support. The only thing that is unacceptable is not trying. We all have our own special skills and talents, and we know where our bandwidth lies. We know that there are some folks who are able to come to the Capitol. There are some people who may have the ear of a policymaker while they're at church or they're out in sheer community, speaking to them about, as their constituent, why you care about what you care about, and put the pressure on them and make sure that your voice is louder than others who are not supporting the policies that we know that moms and babies need. For one, there's some folks who say, you know what, I'm going to use my wallet or my pocketbook, and I'm going to support candidates who get it right. So make sure that you're supporting and or running for office if that's your thing. Um, there's something simple as entertaining, responding to a one click to really just flood the committee members with just education on certain topics. But I think just being aware and not cradling and curling up to what can be a very overwhelming experience, for me included, and just making sure that we're doing something. But I think for each of us on a basic level, educating ourselves. And in this anti-Black, very blatantly racist era that we are in, first of all, it's nothing new. It's just more acceptable to be anti Black and anti diversity. Just making sure that you do your own homework to understand the history of racist policies, how we got where we are, and the amount of strategic, systematic policy design that was there and that was implemented at the federal and the state level to create these poor health outcomes, to create the disparities, to create everything. And just know that that same level of intentionality and energy has to go into dismantling it all and accepting nothing less and just really fighting back, because we also cannot fold to what is being forced upon us, saying you can't say Black, you can't say racism, you can't say sexism, you can't say transgender. I mean, that is where it all starts in dictating and scaring people into something. What we can do is we can speak even louder and we can say it anyways, because if you're doing what's right and you were always doing it for the right reasons, it should not be something that should shut you down. So I think that we should stand unified and stand up for the principles that we've always said that we stood up for, now more than ever.
Well,
Frankie
amen to
Robertson.
that. Frankie, you are awesome. You are tough. You show up at the Capitol. You take more crap than most people realize. You are fearless, and you have a lot of people who hold you in high regard and that follow your lead. And so I just want to say thank you for your tenacity, for your compassion, and for your courage, because courage is contagious. And so we have to continue to advocate because, Michelle, seriously, we are in a world of hurt in Louisiana, and it's an all hands on deck moment. So thank you, Frankie.
Thank you, Frankie, so much. We love you, and we're going to be there with you this whole legislative session. And we'd love to have you back.
Thank you. Happy to be back anytime. And thank you both for your fearless dedication, leadership, and advocacy. I think we have to work together despite the forces that try to compartmentalize the work that we do, because it's all connected and we can't stop until they see that. There are no compartments. It is all connected. And we have to make sure that people understand that and move forward to a better place for all of us.
Agreed. So, Melissa, we like to just express our complete and utter exasperation with what the hell is going on, both in Louisiana but around the country. So, I'm gonna start off by telling you what made me think, oh my God, seriously, this week. So there has been this whole back and forth happening in Congress over whether or not new moms can get 12 weeks off and be able to proxy vote so they don't have to just completely miss votes in Congress after they have a baby. A Democratic representative and a Republican representative kind of teamed up and started doing some maneuvering and basically outsmarted Mike Johnson, who, obviously is our favorite, right? Mike Johnson hails from up where you grew up, Melissa, up in Shreveport area. Mike Johnson, with his tiny little Napoleon man complex, like could not be outsmarted by these two women. And so he basically shut Congress down to avoid allowing a vote to go forward on literally just giving new moms 12 weeks to proxy vote so they don't have to miss out on critical votes in Congress to take care of their new babies. I mean, this is just outrageous. And again, this is like pro-life, freaking evangelical, walks with Jesus, Mike Johnson is stopping new moms from being able to participate fully in their jobs in Congress. It's unbelievable.
Oh my God. Let's talk about hypocrisy. Okay. I am from Shreveport originally. I do not know Mike Johnson personally well. When he was in the Louisiana legislature, he always walked around and said, I'm a constitutional lawyer. Um, and he was sort of made fun of because, he's just always been pretentious and sort of, holier than thou. And I think that it really turns people off. But a lot of people really like him because he seems so calm and so nice. And, he does have a good haircut and he does seem like a nice guy.
Well, they do say religion is the opiate of the masses, so maybe he's just high.
Well, here's the deal. He also fancies himself one of the most pro-life people in the country. And this is the ultimate hypocrisy. Okay. During COVID, people could vote by proxy. I do not understand the underlying fear of this. It was intended to be for both new mothers and new fathers. That started out with that Democratic woman congressman who then recruited, I believe, 9 Republicans to go along with her. There's a much greater groundswell. If you are super pro life and all about families and supporting families, this should have been a no brainer. And so that's what I don't understand is that they say one thing and do another. All of this posturing about Jesus and Christianity and compassion and babies. it's just a fraud. It's a fraud because when push came to shove and he could do something to support new parents, both moms and dads, he chose not to. And so I just think this is typical. Michelle, this is typical. We see it in the Louisiana legislature. All of these folks that want to beat their chest and talk about how pro life they are, turn around and be against WIC and turn around and be against uh, Medicaid services for new moms or against other services. Or even in Louisiana, we don't have paid family leave for new parents. We don't have any support of new parents. And so, I just want to call bullshit on pro life Christians who are not in support of families and are not in support of encouraging people to raise healthy babies and do not think strategically at all about what we can do to ensure that our most vulnerable brand new citizens get off to a good start with love, compassion, food, care, uh, and the stability that they need to start a new life. And
Yeah.
I, just don't get me started on Mike Johnson and the Congress because these guys don't care about people. They don't care about people. Right now,
Yeah.
they care about Donald Trump, and that's all they seem to care about. And Donald Trump is a cancer on the country. And the mentality of make America white again and this white Christian nationalism, racism is setting our country back 100 years, and it's just appalling.
Yeah, I hear that. All right. Well, so that was mine. Do you have anything else you want to rant about today, Melissa?
Well, I guess I just want to rant about why we want poor people in our country. We're making policy decisions every day to keep people poor. And and then we want to demonize poverty. And so I just want to get people to sort of wake up and understand what's really going on, and to understand that here in the state of Louisiana, we haven't raised the minimum wage since 2009. We don't provide access to any kind of paid leave, that we have a policy of keeping people poor, and then we want to punish them because they're too poor. And we want to defund education. We want to defund healthcare. We want to defund services in communities. We want to defund childcare and quality childcare. But we want to build juvenile prisons and prosecute 15-year-olds as adults. We just beat back some terrible constitutional amendments at the end of March. But in our new legislative session, we want to have a new bill that says we can prosecute 15-year-olds as adults. We want to spend hundreds of millions of dollars building juvenile prisons. And so I just want to say, let's spend hundreds of millions of dollars on babies and young kids and elementary age kids so they don't need to go to prison. Okay. Pay for it now or pay more later. I've been saying this for 35 years in the Louisiana legislature, and I am just beyond aggravated because we see prisons as economic development, and we now see juvenile prisons as rural economic development. And so my new frustration is private prisons. And here in Louisiana, we have more ICE detainees in private prisons in Louisiana, second only to Texas. And so there is something bad wrong in the dark heart of our elected officials. We need to do more than pray for them. We need to organize. We need to get people to run. We need to have transformational and generational change in Louisiana. And we need to put people first and not put money first. And so I'm aggravated most of the time, Michelle, but I'm appreciate the opportunity to be on with you because Louisiana. Most folks think that we can't change Louisiana, so why bother? And the only thing I will say is we definitely can't change Louisiana if we don't show up. And so we have to keep fighting and keep organizing and keep educating and encouraging young people across the state of Louisiana to be better informed and to call their legislators to show up at the Capitol and literally say, enough is enough. We can do better. We can do better, and we deserve better in Louisiana. I want to do a commercial for 10,000 women. If anybody in Louisiana is listening to this podcast, go to 10,000 Women Louisiana and sign up for training on advocacy. Look at ways to come to the Capitol. 10,000 Women partners with Lift Louisiana for our Women on Wednesday initiative. We're trying to get more women across the state of Louisiana to be informed advocates because we need people to stand up, speak up, show up, and fight back. And so women of all ages and races need to see the utility and the solidarity that we are all in this together, and we need to work together to lift up the voices of all people in Louisiana, especially our most disadvantaged and most vulnerable pregnant mothers in a time of crisis.
I just want to thank you so much, Melissa, for guest hosting. This was a pleasure. I hope we can do it again. We are going to be hosting people at the Capitol for Reproductive Freedom Day on May 7th. So we will put a link in the show notes for how people can register for that. You can come to the Capitol, you can learn how to advocate, see how the legislative process works. We'll hopefully try to connect you to meet with your legislator, have a conversation with them. Some of them are too scared to come talk to their constituents, but we know who they are, so we can confront them. Yeah, that's probably just going to do it for us this week.
Well, thanks, Michelle. It's great to be out here in the world advocating with you and all the folks that care about women's rights and children's rights and reproductive rights here in Louisiana and across the country. And we've got to all understand that we've got to continue to show up every day. And so thank you for the opportunity to be on with you on Seriously, because Louisiana, we are the canary in the coal mine. And thank you for the opportunity. I appreciate it.
All right. We'll talk to y'all next week.
Seriously is presented by Lift Louisiana, a nonprofit organization advocating for reproductive health rights and justice.